Perfect. So, hi everyone. We are here today as the third and final session of our Alzheimer's disease educational series. Over the past 2 weeks, we've been talking about the basics of Alzheimer's disease, kind of the symptoms, how to prevent disease progression. And we've also covered clinical trials, the different phases that are included in those types of trials. And if you're interested in participating at the Center for Alzheimer's Research and Treatment at Brigham and Women's Hospital, the ways that you can start screening for our trials and getting involved in that way. For today, we are going to really focus in on empowering caregivers and really making sure that caregivers' mental and physical well-being is also being prioritized while caring for someone that is developing Alzheimer's disease. So let's get started. First, I wanted to cover the caregiver's role. As a caregiver for someone with Alzheimer's, your responsibilities can include getting their health, legal, and financial affairs in order, especially as they start progressing further into the disease and may not be able to keep track of numbers, documents, remembering appointments, things like that. You're also may be responsible for evaluating their home and making sure that it's safe for their needs, especially if there are stairs involved, making sure that they aren't prone to falls, and that they're keeping their balance whenever necessary. You may also be responsible for monitoring their ability to drive, encouraging them to get physical activity, and having a healthy diet, as these are all things that can help in preventing a faster progression of the disease. You may also have to help with daily tasks, again, as they get further progressed, especially bathing, eating, taking medicine, as that's something that is easily forgotten, as well as doing any housework and cooking, running errands. Providing company and emotional support is a very big part of that caregiver role, especially when it falls to someone within the family, as well as arranging any medical care and making health decisions, especially in the later stages when they aren't able to cognitively make decisions for themselves. So with that, as you care for someone with Alzheimer's disease, we really stress that it's important not to ignore your own needs. As humans, we have our own emotional and mental health to worry about or to really focus in on supporting. And so there are a couple ways that we can prevent or relieve caregiver stress. This stress is just a result of the emotional and physical strain of caregiving, and it can include feeling overwhelmed, feeling alone, isolated, or deserted by others, especially in the sense that nobody else may be caring for the person developing Alzheimer's disease. So you can feel a little bit alone in that. Caregiver stress also includes sleeping too much or too little, depending on the emotional weight of being a caregiver. And so in order to prevent or relieve this stress, we can learn better ways to help our loved one. Hospitals offer classes that can teach you how to care for someone with specific illnesses, Alzheimer's being one of them. And you can also find resources for caregiving within your community. They have often adult daycare services or respite care that you could lean into, at least to learn what's available. One thing that I really stress is that you have to ask for and be able to accept help when you need it, whether it's from other family members or from community resources, such as these adult daycare centers, things like that. You could also join a support group for caregivers. There are a couple that we'll get into a little bit later in the presentation, but the Alzheimer's Association has a list of support groups within your given area, whether it's in a state or in a city. And also staying in touch with family and friends in the ways that some of this caregiver stress can come from isolating or feeling alone in caring for someone. Definitely maintaining social connections and emotional connections with the people that you love can help relieve that stress. And at the end of the day, as the disease progresses, it might take up a lot more time in your day-to-day life than you were expecting. So if you need to consider a break from your job, if you're feeling overwhelmed, if that's something that you can financially take on, that's definitely something that would help at least manage the time a little bit better. Um, and it's really important to make sure that we take action to prevent or relieve this caregiver stress, because long-term caregiver stress may put you at risk for a variety of health issues, such as depression and anxiety, obesity, chronic diseases like heart disease, diabetes, arthritis. These are all rooted in stress. So definitely paying attention to that is important. All right. We also have a couple family dynamics that could be changing as a result of someone being diagnosed with Alzheimer's disease, especially as these diseases tend to affect people in their later stages of life. There can be what we call role reversal. So, this is when you experience feelings of grief when you administer the care that a parent once provided for you. As babies are growing up, obviously we tend to rely on our parents to care for us. But if our parents or grandparents are now developing Alzheimer's disease, that role reversal manifests itself as us having to help them feed themselves, bathe themselves, dress themselves, and really any activities of daily living. You can also see an increase in guilt between different family members, especially if there are some that are picking up the weight more than the others. You may feel that either your siblings or other members of your family, even close friends, may not be adequately caring for their loved one. And you could also feel guilty yourself for being tired or feeling like you need a break as a comparison to the disease that your loved one is going through. But it's really important, again, like I was saying before, to make sure that you are taking care of yourself. It's normal to feel tired. It's normal to need a break, especially under emotionally tense situations. Another family dynamic that could arise is a feeling of resentment, especially for any additional responsibilities and time commitments that come from being a caregiver. Like I was saying before, this time commitment may be so large as the disease gets worse that you may have to think about leaving your job for a little bit. So that feeling of resentment may build. And again, if there's not an equal distribution of caregiving within different family members, that feeling of resentment towards others may build as well. With all of this being said, these are all prone for emotional changes, whether they are directed at a specific family member or just over the situation in general. Whenever someone gets diagnosed with Alzheimer's disease or another, what we call end of life disease, fear, anger, grief, denial, these are all emotions that tend to creep up in waves all at once. So definitely just keeping track of those emotional changes and trying not to direct them at a certain person. I know it's easier said than done, but yeah, these are all just the changes that can arise with a diagnosis. And so there are different ways to adjust to those changes. These are definitely just some tips for helping navigate those. You don't have to do all of them. It may be hard to do some. As always, easier said than done to be patient. Adjustment will not happen overnight, especially if you're having different conversations with different family members about how they could better step up. It may take some time to see that work and that adjustment being put into place. Alzheimer's is what we call a progressive disease. So not only do you have to effectively handle the progression of that, but making adjustments over time will also be necessary. And it's really important to remember that every step in this journey is a new one for everybody involved. Not only that person being diagnosed with Alzheimer's, but everyone involved in the caregiving roles and everyone in the family, especially if this is the first time that we're seeing Alzheimer's disease. within the family. You also should be discussing caregiving responsibilities, specifically if you are able to split them up between different family members, who is going to take care of companionship, different meals. Maybe someone can stay home with the patient while others run out to do errands like laundry, making doctor's appointments, things like that. Um, with that discussion, having family meetings and listening is always very important, just so you can discuss how that disease is progressing and if the current level of care, if that division of care is working for everybody. Um, Definitely being able to rely on each other for those emotional changes, the grief, the disappointment, the denial that can come with it, and eventually the loss that comes with Alzheimer's disease. Definitely try leaning on each other for that. And again, if these family dynamics you are seeing are splitting up the family in any way, whether it's emotional, physical, you can always seek help from an outside party, whether it's a mediator, a counselor. You can definitely look into those resources in your area, specifically for those that deal with dementia care and families. Um, Alzheimer's Association has consultants on their helpline. I will give you those resources and that helpline number specifically in a few slides, but they are available 24/7. So you definitely have someone that you could reach out to if you ever need. Okay, now I want to shift gears a little bit to talk about the 10 steps that the Alzheimer's Association has listed when approaching memory concerns in others. So this may be before even getting a diagnosis. If you're seeing a family member or a loved one in general, start acting a little bit different. Maybe you are beginning to get concerned about them misplacing things, forgetting conversations that you've had, anything in general out of those early symptoms that we see Alzheimer's disease patients have, which we've covered in a previous session. But these 10 steps begin with what changes in memory, thinking, or behavior do you see? So, what is the person doing or maybe not doing anymore that is out of the ordinary? Coming up with specific examples might help you really verbalize this either to the patient or to others that are part of their loved one's community. Second, what else is going on? If there's any health or lifestyle issue that could be a factor, Alzheimer's disease has a lot of comorbidities that either increase the risk for progression of dementia or play a role in that in any way. So, family stress, health issues like diabetes or depression are some of those that could be comorbidities. Third is to learn about the signs of Alzheimer's and other dementias, especially how other dementias differ from Alzheimer's disease. So we covered these early symptoms in the first week of our series, but do you notice any of these symptoms in the person that you're concerned about? That's really what we're focused on here. The fourth is if anyone else has noticed the changes. So any other family members, any friends, or people that they interact with on a day-to-day basis. It may be a little bit hard to find out if the person themselves has noticed any changes in their memory or functional abilities, especially because they may just be brushing it off as part of normal aging. Fifth would be who should have the conversation to discuss these concerns. So just because you were the first one to note them doesn't mean that the person may feel most comfortable with you having that conversation. So we really want the person to have a combination of either trusted family members or friends, unless they prefer to be spoken to on a one-on-one basis so that they don't feel threatened by a group. Basically, we're trying to decide what would be most comfortable for the person that you are concerned about. That is key. And sixth would be, what is the best time and place to have this conversation? We definitely recommend that you have this conversation as soon as possible, just so that you can start the process of if they want to see a doctor, getting that diagnosis as soon as possible, learning what resources are out there, making sure that the person feels supported in the process. In terms of a place, we really, again, want to consider where that person is as comfortable as possible, whether it's at home, in their happy place, if that's somewhere in the community, at a park, whatever it may be. We definitely don't want it to be too overstimulating though, because that also adds to a lack of focus. They could get easily overwhelmed, things like that. Seventh asks, what will you or the person having the conversation say? Again, when I talked about what changes or behaviors you're noticing, I specified coming up with specific examples so that when you're having this conversation, you can kind of bring those to light. You can word it as, I've noticed this specific change in you and I'm concerned. Have you noticed it? Are you worried? Kind of trying to get their input a little bit. You can also ask how they've been feeling lately. If they haven't seemed like themselves, you can say that. Or I noticed you did a specific example a little bit differently and it worried me. Has anything else like that happened? Just so you can start tracking if this is common and you were the first one to realize it. Maybe they have realized it too, but haven't thought it was that concerning. The eighth is to offer to go to the doctor with this person. Often, they may not want to go alone. It can be a little bit scary, and they may not want to go to the doctor at all. But you can say that talking to a doctor could offer peace of mind. There are lots of things that could be causing this breach in either cognition or executive function. So, dementia may or may not be one of them. Let's go see a doctor to help us figure out what's going on. Kind of approaching it from they are going to be a resource rather than they're going to give you a very negative diagnosis that will change your life, right? Which either could be true, but just the way that you word it really helps the person feel more comfortable about going to see the doctor. Again, similarly, the sooner we know what's causing these problems, the sooner we can address it, kind of not a super big sense of urgency, but they need to make sure that they are seeing a doctor soon. 9, if needed, you can have multiple conversations. Often the first time you reach out to the person about any memory concerns you may be noticing, they may not want to pay attention to it. They may not want to hear what you're saying. They could be in denial themselves. So you can reassess how you've approached that conversation, maybe who was involved in the conversation, and try again. It might take a couple of times before they are open and willing to go to the doctor. Lastly, you can turn to educational resources for information and support. Alzheimer's Association has great ones, which we will cover in the next few slides. So, in terms of some tips for communicating with someone who has dementia, when you're having these conversations raising concerns, make sure to speak slowly and use simple language. Allow them some time to respond. Don't interrupt them if they're thinking. They may be taking some time to really come up with the right words, assess how they are feeling about the situation. So give them the time to do so. I would definitely recommend speaking face to face rather than on the phone or virtually, just because it really heightens that emotional connection. That feeling of support, physically being there for someone is very important. Similar to using simple language and speaking slowly, definitely try to do it in a pleasant tone with a calm expression. If you are overwhelmed or scared or nervous, that feeling and emotion is going to be passed on to the person that you're having the conversation with. So definitely try to go into it with a clear and calm mind. Again, I know easier said than done, but just try. The fifth is to avoid asking open-ended questions. Often that can lead to overwhelming thoughts in the brain, overthinking. And so yes or no questions may be easier. I've noticed this change. Has that happened to you before? Yes or no, as an example. You can also use visual prompts if possible, maybe not necessarily when having the conversation addressing their memory concerns or changes, but as the disease progresses, right? If you're trying to help them choose between different foods, different articles of clothing, being able to point and note differences visually really helps them process that decision in their brain. All right, now I want to shift gears a little bit again to talk about Alzheimer's disease in the East Boston community. So, according to the Massachusetts Healthy Aging Community Profile done in 2025, about 16% of East Boston residents over the age of 65 have Alzheimer's disease or another type of dementia. And that's a bit higher than the Massachusetts state rate of 12.9%, so around 13, just a little bit higher in East Boston, but still a noted difference. 57% of Hispanic Americans believe that a significant loss of memory or cognitive abilities is a normal part of aging. And I think, at least me myself, as a Colombian, I've seen that in my own family where my grandma tends to brush off any changes to her memory, any changes to her physical ability because of normal aging. But we've covered in week 1 of this series the real differences between normal and abnormal aging. And it really comes down to, are these memory changes affecting your day-to-day life and functioning? Because if they are, that could really shift into abnormal aging, maybe some form of cognitive impairment or dementia. I also think that with Hispanic Americans, this language barrier between our community and American physicians can often get in the way of expressing how much our memory may be truly changing and how many of our daily activities may be impacted because of that. So that could definitely contribute to this demographic change. Hispanics are also 1.5 times more likely than non-Hispanic whites to develop dementia, but we don't really know why yet. And that is why it is so important for Hispanics to be more represented in clinical trials and research in general, not just for Alzheimer's, but a lot of other medical diseases. Just to understand why this difference in like disease risk is so much higher for Hispanics. Okay, with that being said, sometimes, especially at our center, you need to get an official diagnosis before you are able to participate in clinical trials. So in order to do that, you may have to do multiple tests because not a single test can determine if someone is living with Alzheimer's or another form of dementia. So to make an accurate diagnosis, physicians use a combination of diagnostic tools. Medical history is a big one, especially comparing your current and past medical problems to your current health state. As I've already mentioned, depression, chronic heart disease, there are a lot of other diseases that play a role to increase the risk for developing Alzheimer's disease. So looking at that medical history is definitely key. You can also use that medical history to see if anyone in their family has had Alzheimer's disease as a genetic hereditary disease. It increases the risk for developing that. Physicians also use physical and neurological exams to make these diagnoses. So physical exams and lab tests can really help identify dementia-like symptoms, especially if they may be being caused by some other health issue. These common causes of dementia-like symptoms can include depression, untreated sleep apnea, side effects of medications at times. So looking at what medications patients are on is also important throughout that medical history review, as well as any thyroid problems, vitamin deficiencies, excessive alcohol consumption. All of these can manifest themselves in a lack of short-term memory, other what we say are early symptoms of Alzheimer's disease. So it may not be an actual dementia cause that all these symptoms are popping up. And that's why it's so important to get that diagnosis from a physician. Neurological exams can also help rule out other brain disorders that may be causing this other than Alzheimer's. So they often look for signs of stroke, Parkinson's, brain tumors, any buildup of fluid in the brain, or other other conditions that can impair memory or thinking in general. There are cognitive and behavioral assessments that can be done, specifically little memory tests that test thinking and simple problem solving. So they can show if a person is experiencing cognitive symptoms and if they are aware of the symptoms. These tests often ask if a person knows the date, time, where they are, and if they can remember a short list of words, if they can follow instructions, if they can perform simple calculations. That's really what we're trying to assess. Physicians will also do brain imaging to help rule out other conditions. So magnetic resonance screens, CT and PET scans, these are all used to paint a structural image that can reveal tumors, again, any evidence of strokes, any damage from severe head trauma, or again, buildup of fluid in the brain. For Alzheimer's specifically, research has proven that high levels of beta amyloid, which are these specific proteins that are found in the brain, but if there are high levels of misfolded proteins, then it's likely that the patient has Alzheimer's disease. So brain imaging is definitely one of those tests that are very often used to diagnose rather than to rule out other diseases. Similarly, we can do cerebrospinal fluid or blood tests. Cerebrospinal fluid is that fluid that is found within the brain and spine. And so we do lumbar punctures as a procedure to extract a little bit of that fluid that we can then run some tests on to see what biomarker levels are like in different patients. And again, research has suggested that early stage Alzheimer's disease can be diagnosed with a specific level of those biomarkers in the cerebrospinal fluid. So that is what we currently use as the standard for diagnosing. Maybe it's a mix of imaging and a lumbar puncture, but a lumbar puncture is a bit invasive. It's uncomfortable. Both the brain scans and the lumbar puncture can get a little bit expensive. So blood tests are currently in the process of getting developed to help track the differences in those proteins and biomarker levels. And there is an urgent need for this type of blood test, just so that it's simple, inexpensive, non-invasive, and easily available and accessible to all as a diagnostic tool. So at NeighborHealth specifically, there is a community resource and wellness center helpline, which I've listed on the slide. If you ever have any questions about what resources are available in your community health-wise. They also have senior care options where, again, I have a phone number listed that you can call for information. But people over the age of 65 qualifying for Medicare and Mass Health, if they're living at home or in a long-term care facility and are in an area served by this type of plan, you may be able to use NeighborHealth clinics without having to pay a copay. You can also get medications, dental exams, and dentures, any eyeglasses or hearing aids, home care services, and a 24-hour-a-day access to nurses or providers in case of emergencies. This is one of the care options that NeighborHealth offers. NeighborHealth also has what they call a neighborhood PACE program that stands for Programs of All-Inclusive Care for the Elderly. Again, I've listed a number you can call for information. And these requirements are a bit different. So these people can be over the age of 55 who qualify for nursing facility level of care as determined by the Commonwealth of Massachusetts. You wouldn't have to pay copays or deductibles or any insurance gaps. And these PACE neighborhood programs offer on-site medical clinics, rehab gyms, especially if you're coming back from an orthopedic injury. They also help develop fitness plans and nutritional plans. They host wellness workshops. They have diagnostic services, which, as I've mentioned, is crucial for if you want to get involved in Alzheimer's disease clinical trials or any other research, a diagnosis is imperative to do so. Neighborhood PACE also offers transportation to appointments and PACE centers. So if you don't have a way to get to the research hospital, maybe this is a way that you could find a loophole for that. All right, and now moving away from NeighborHealth, as I mentioned a few times, that the Alzheimer's Association has a couple of different support resources you can use, and they are all free of charge. So they have a lot of support groups for either early stage dementia, if you are the patient, or if you are the caregiver. And they are at no cost to participants. They are often led by trained facilitators, whether it's over the phone, on video chat, or in person. If you have family kind of scattered throughout the state, scattered throughout the country, maybe a video chat support group could be really nice. So definitely whatever works for you and your loved ones. They also have time-limited specialized support groups. So these are to learn more about specifically people who have Alzheimer's disease or other dementias rather than just offering care as a caregiver in general. I've listed a phone number or even an email that you can contact to learn about where and when those local groups are meeting. The Alzheimer's Association also has an online community through this website that I've listed, where members can post questions about dementia-related issues, offer any support and guidance, and create public or private groups around specific topics. We've already mentioned that a part of caregiver stress is feeling isolated in this process. So this online community may just help bounce off some feelings, emotions, ideas, really feel connected with other people that are going through something similar to you. And they also have a 24/7 helpline. So if you ever need confidential emotional support, if you're in a crisis and need assistance, if you want to learn about the local resources, whether they are support groups or other types of resources, you can call this helpline. And this information is available in over 200 languages. So whether you're speaking in Spanish, Portuguese, English, any other language that you and your family are comfortable using, this helpline is definitely a resource that can help you out. Okay, and now I want us to think about if we've ever considered participating in clinical trials. I feel like clinical trials are often mystified. You don't really know how to get involved in them. I know that we covered that mostly last week, but clinical trials are in general just testing therapies, and they can be considered as innovative treatment options. So, for example, cancer clinical trials are not always seen as a last resort. They can be an option at any stage of the treatment, including early stages. I feel that clinical trials in cancer care is pretty normal. It's pretty included in the types of conversations you're having with your cancer physician or the oncologist. In Alzheimer's disease or in neurology in general, we don't tend to see that use of clinical trials as a treatment option as often. But at our center, we have a lot of studies for preclinical Alzheimer's disease. So those are for people who are at higher risk for developing the disease, but maybe haven't started to show symptoms or haven't started to see, in terms of like the brain images, any actual physiological change. But as we've noticed that there are so many things that can contribute to whether or not you may develop Alzheimer's disease. Not only is it family history and genetics and age, but it's also your environment, it's your social interactions, it's the comorbidities that are involved in your health. So these preclinical studies can serve as a way for you to keep checking up on your health, making sure that nothing weird is going on. And if you do have a family history of Alzheimer's disease, at least you're in a place where if anything is changing, we can track it and check it early. If not, though, at least you're helping other people in the future that may be getting Alzheimer's disease. The more research we do, the more we can learn about how to target early disease progression and hopefully one day cure the disease. We also have studies for mild to moderate Alzheimer's disease. So those are people who are already exhibiting brain pathology and cognitive symptoms. And the main study that has come out of our center in the last few years is called AHEAD. This has tested the drug lecanemab, which is the first of its kind to slow the progression of Alzheimer's disease in early stages. The FDA approved it as a medication in the summer of 2023, and we are now seeing patients actually getting the medication in clinic in real world applications. So that has been really exciting, but it wouldn't have been possible without the use of clinical trials, and most importantly, without the research participants that gave their time and energy to do this. I have a couple of resources, what we call the Aging and Memory Loss Roadmap. You can scan the QR codes, whether you want it in English or Spanish, but this really covers a plethora of information about what to do when you receive a diagnosis, how to participate in research, what caregiving is like, any preventative things you can do to help mitigate the progression of the disease, as well as tracking behavioral changes, how to stay socially engaged, and any acute care management. And yeah, these were developed by the Massachusetts Alzheimer's Disease Research Center. We work with them a lot in terms of community outreach for our center and the Mass General Brigham institution in general. All right, so in terms of medical and clinical services at Brigham and Women's Hospital, we have our Neurological Center for Cognitive and Behavioral Health. This provides interdisciplinary care for Alzheimer's patients and their families, especially getting diagnoses. I know it can be a little bit tricky or just long wait times to really get in for your first visit with a neurologist, but definitely important to get that diagnosis as soon as you can. MGH also has a memory disorders unit in Beacon Hill, which provides comprehensive diagnostic and treatment services for various types of dementia. And they have a lot of Spanish-speaking staff, which is great, especially since it's closer to East Boston than Brigham and Women's might be in Longwood. Again, Alzheimer's Association has some care consultations that are completely free and confidential. They are often personalized to the needs of the individual and their families, specifically whatever language you may be, whatever topics you want to discuss. And they can be over phone or video. And like I was saying, you can include family members from various locations, which is really nice if the family is scattered throughout the country or the state. In order to schedule a care consultation, you can call these numbers on the screen for English or Spanish, respectively. And I also included the email in case you maybe want to learn more about what a care consultation entails before giving them a call. All right, thank you so much for not only attending this weekly educational presentation, but if you attended the last two, thank you for coming out to learn more about Alzheimer's disease, clinical trials at the Center for Alzheimer's Research and Treatment, and what you can do as a caregiver to best support your loved one. If you have any questions, if you want to learn more about what we're doing at the center, we have our website and our phone number. Please feel free to reach out to us. And as always, if you're seeking any resources or support, the Alzheimer's Association support line is a great resource. So I've included it again here. Now we have Corrine White from the Age Strong Commission, who is going to present some financial information that is important as you're getting an Alzheimer's or other type of dementia diagnosis. So I'm going to pass it on to her.
Thank you, Stephanie. That was great information. Do you want me to share my screen? Okay.
Yeah, that would be great.
I don't know if. Okay. Um, Can you see it?
Yes.
Beautiful. Okay. Hi, everyone. Thanks for being here. I have been tasked to explain some of the financial support options that are available for people who are caring for someone living with dementia. My name is Corinne White. I work for the City of Boston's Age Strong Commission, and what I do there is lead the Dementia Friendly Initiative, which is a World Health Organization initiative servicing 8 domains of interconnected daily life. And I run a lot of programs for people living with dementia and programs for care partners of people living with dementia, and I do a lot of education. So today, we are going to talk about financial support programs. These are not comprehensive, but it's what's available. And so I want to just make folks aware of what is out there. And you can always reach me at the Age Strong Commission if you have any additional questions. But first, we'll talk about home care programs, then we'll talk about mass health programs, and finally, a Medicare program that is fairly new. So in Boston, I speak for Boston only. We have the Council on Aging, which is us, the Age Strong Commission, and then we also have Aging Service Access Points. The Aging Service Access Points, I will talk about what they do in just a second. But as you can see here for East Boston, it's Boston Senior Home Care. For all of them, for any of them, the way that you would start is through going through Boston Elder Info, which I don't know, to be honest with you, if I put the phone number in there, but certainly can get that to you. What home care-based services are these services and supports listed here. So for home care, through Boston Senior Home Care in the East Boston area, you might be eligible for home delivered meals, grocery shopping, chore service, homemaking services, personal care, laundry service, and or respite. These programs are based on financial eligibility. It has nothing to do with your health insurance, so that does not matter. It's all financial eligibility based on a sliding scale. So some of these programs may be free of cost, dependent upon your financial status, and some of them may cost a copay. They also have specialized care in home care, such as skilled services, home health aid services, medical escorts, a money management program, and companionship, and additional supports that the Aging Service Access Point may be able to support you with is adult day health programs, transportation, respite beds in a facility setting, habilitation therapy, evidence-based programs, including falls prevention, and something like a caregiver support program. So lots of options. Again, the way to reach your local aging service access point in Boston is to go through Boston Elder Info. I wanted to highlight specifically the Family Caregiver Support Program through Boston Senior Home Care. They employ caregiver advisors who truly understand the complexity of managing someone's care in the home. So what they will do is help enroll in the program. They'll do a thorough assessment of the situation and ensure that the services and supports that are provided are person-centered and meet individual needs. The caregiver services that they're able to offer include, again, the in-home services and supports. There's counseling. They have several different options for caregiver support groups, including virtual options. These are really important because they're local to Boston. If you did have a family member, like Stephanie was saying, that is out of the city or out of state, those loved ones could also join, but it is connecting with others who are going through a similar situation within the city of Boston. They also do caregiving education and training. They can help with referrals to elder law offices. This is truly important for long-term care planning and estate planning, as Stephanie mentioned. I'm here to help with financial supports, but an elder law attorney is definitely necessary for estate planning and legal documents. They can provide information and referrals to resources, a whole slew of supports. Okay, now I'd like to talk about what options are available through the Mass Health Program or the Massachusetts Medicaid. So Stephanie mentioned, senior care options, but I also have a few other programs that I wanted to talk about. The first being the Frail Elder Waiver. The Frail Elder Waiver is a program through Mass Health that does have eligibility requirements. If someone were to meet the eligibility requirements, the Frail Elder Waiver allows for a larger amount of services to be placed in a home or community-based setting for the individual. So I just showed you the list of in-home services that are available through the Aging Service Access Point. What the Frail Elder Waiver allows is a broader amount or a larger amount of hours available to the individual for these services. So the participant must reside in their own home or apartment or the home or apartment of a family member or loved one. They must be 60 to 64 years of age and have a disability or 65 years of age or older. The clinical requirements are the skilled nursing requirements as decided by the Commonwealth of Massachusetts. They must need these services. They must be able to be safely in the home with these services. And again, they must meet the financial requirements. Other Mass Health services that I wanted to discuss today include the Senior Care Options Program. Stephanie mentioned this briefly. The Senior Care Option Program is coordinated care services. I think that's the best benefit of having the Senior Care Options Program, which is that someone who's duly eligible for Medicare and Mass Health basically gets a personalized care coordinator. And this person can coordinate services amongst the PCP, primary care, nurses, specialists, etc., family members, everyone. Huge benefit of the Senior Care Options Plan. The other plan that I wanted to, or program that I wanted to talk about is adult foster care. This program allows shared living for elderly and disabled individuals. I don't part I took this language straight from the Massachusetts government website, Mass Health website. So yeah, just to make sure that the language was there, but to sum it up for you, someone can live within a home where they are able to get a primary care partner that's paid. And so this person has to be eligible for Mass Health Standard or Common Health with a chronic condition and require 24-hour care. But it gives the personal care assistance to a responsible party that might be a loved one or a trusted person, as opposed to living in a assisted living or a memory care unit where people are not as familiar. So the care partner is allowed to be a friend, a relative, or sibling. It is just not allowed to be a spouse or legal guardian. And then the final Mass Health program that I wanted to share with you is the Personal Care Attendant Program. It's available to anyone who is eligible for Mass Health Standard or Common Health and needs assistance with at least 2 activities of daily living. Stephanie mentioned these before also: bathing, dressing, medications, eating, transferring or moving inside of the home, so mobility assistance. And the personal care attendant program allows the individual to basically be the employer of the person that's taking care of them. So they would supervise their own care. Potentially, this would only work or benefit in the early stages of dementia, but still an option through Mass Health. Because ultimately, that person has to maintain being the employer. And so as the disease progresses, it might no longer be an option for an individual living with dementia. Stephanie also mentioned PACE. I cannot overstate the benefit of PACE, the program of all-inclusive care for the elderly. It is administered by Mass Health and Medicare. However, you do not need to have Mass Health to enroll in PACE. If you do have Mass Health, it will cover the premium of the PACE program. But if you do not, based on the PACE program and the financial eligibility of the individual. Um, the PACE program, however, provides, like Stephanie was saying, comprehensive medical care and supportive services. So they do medical care, specialty care, physical and occupational therapies, meal planning, nutritional counseling, personal care, home health care, prescription drug distribution, social services, super important, respite care, super important, etc. And so with PACE, the benefit is that the PACE program will either be brought to the individual's home and or the individual can go into the PACE center to get care. And this could just be medical appointments in person, or it could be the social services or the respite care. PACE may have an adult day health program or a social day program in which the participant is able to stay all day. Okay. Lastly, oops, I'm so sorry. Lastly, I wanted to discuss this new guide model distributed through the Center for Medicare Services. The guide model is comprehensive, coordinated dementia care that aims to improve the quality of life for people with dementia, reduce strain on unpaid caregivers, and enable people with dementia to remain in their homes and communities. Um, Boston is #1 for economic insecurity for older adults. This is not a statistic that we are proud of, but it's truly an impactful, uh, obviously impactful to our daily life to have such high economic insecurity. And when you're caring for someone who lives with dementia, oftentimes the primary care partner is unpaid. And so the unpaid part of providing this care, it is very costly. It takes a lot of energy, and sometimes it takes your own money that you're providing to the person living with dementia. And so, with this large economic responsibility, the guide model is really trying to eliminate that huge burden of financial responsibility. And so, for the patient to be eligible, they have to have a dementia diagnosis. So, this could be done through the primary care physician or their neurologist, as Stephanie mentioned. They have to have Medicare as a primary payer, um, and they have to be enrolled in both Parts A and Part B. It does not matter what other supplemental Medicare, um, or Mass Health benefit the person has, except they cannot be enrolled in a Medicare Advantage plan. So that can be very confusing for folks. Medicare is a very intricate system. If anyone needs assistance, the H Strong Commission has certified health insurance counselors that can assist in this way, including myself. And so if anyone's interested in this program, please reach out. And then unfortunately, the only other eligibility criteria is that the person cannot be enrolled in PACE or the Program for All-Inclusive Care of the Elderly, like I just mentioned. So it has to be an either or. Otherwise, there's no financial eligibility for this program. The benefit of this program, and it is a huge benefit, is that the participant will assign the person living with dementia and their care partner to a care navigator. This is the primary benefit of the program. The care navigator will help them access all the services and supports and non-guide services and supports, including clinical services, non-clinical services, and really truly just anything that will meet the need of the participant.
give her Corey another minute or two.
And resources that the care partner needs. So this $500 per year, it can be used for any sort of respite service, which allows the care partner to take a break. And the respite services include anything from like needing something in the home to a piece of equipment in the home to like an actual respite stay. I also was asked to speak about paid family medical leave. This program is really hard to talk about because it's pretty standard for employers in Massachusetts, but it's very individualistic and unique to the employee. So my best advice is this is available, especially because it provides up to 12 weeks of paid leave per benefit year in order to care for a loved one. The options are listed here. But it has to be certified by a healthcare provider, and then you really do need to have a discussion with your employer in order to apply, because again, it's a very unique situation to the employee's status based on the benefits, the amount of hours they work, and when the benefit year may start. So another intricate program that either you can talk to your employer about or feel free to call the Age Strong Commission. And I know I rushed through my financial supports there, but I wanted to leave time for questions. And again, just wanted to mention the Age Strong Commission is there for health insurance needs, for financial eligibility needs. I am constantly referring and providing resources to folks living with dementia and their care partners. And additionally, Age Strong has a senior center in East Boston, the East Boston Senior Center. So highly recommend going there to seek assistance as well.
Thank you so much, Corinne. I also forgot to ask if anyone has any questions at the end of my presentation or for Corinne, please feel free to voice them. Okay.
Okay, if not, I believe you both left contact info in your slides, so hopefully people can reach out. If not, they can reach out to me, training@neighborhealth.com.
Perfect. Thank you so much.
Thanks, everyone. Thanks, Alita.
Thank you.